I started my career a long time ago, in 2001, and over the past 2 decades, I've seen 3 important paradigm changes that have happened in the field. First, from fragmentation and silos of diseases, disciplines, and institutions to a more unified vision of the brain as one interconnected system, and correspondingly a more collaborative and coordinated ecosystem. Second, from the brain as a closed system to an understanding that the brain does not exist in isolation. It is impacted by the rest of the human system, by our environment, and by our lifestyle, and it changes across the course of our lives. And most recently, from a deficit or healthcare approach to an asset or health promotion approach of prevention, wellness, and optimization. And under this paradigm, brain health is more than the absence of a disease, and it's what we want to achieve for every citizen in the world. Now, as the founding CEO of Brain Canada, I had the privilege of working with the late Honourable Michael H. Wilson and with Alan R. Taylor and Rupert Duchenne to build a national organization to advance excellent and innovative research on the brain. But in the beginning, the organization was called Neuroscience Canada because brain research was narrowly focused on this one field. But in 1990, the US had declared the Decade of the Brain, and what followed was unprecedented attention and investment in research to understand the brain and brain disorders. And this led to a recognition that the brain is actually one complex interconnected system, and studying the brain involves different fields and disciplines beyond traditional neuroscience. It also meant that the disease silos that had fragmented research, funding, and policy were being replaced by a more holistic vision of the brain, where there are common underlying mechanisms across brain disorders. And therefore, to accelerate research and to achieve better outcomes, we needed to connect all those who are working in the brain ecosystem with common purpose. This was an approach that I called One Brain, One Community. One Brain, One Community allowed us to better understand the combined direct and indirect health, societal, and economic costs of brain diseases, disorders, and injuries, which are greater than cancer and cardiovascular disease combined.